Thanks for inviting me, and I'm going to talk about bone marrow derived CD34 cells and leukocytes in a big quantity of children and adults with non-malignant diseases. We today take a closer look at what is in the bone marrow. Besides of the red blood count and the plasma, we are interested in the cells, which are in the Buffy code. To answer this question, we conducted a prospective case control study several years ago together with the University of Graz, with a laboratory in Munich and our institute in Graz, which is of course IRB approved, and we were looking at the mononuclear cells, the CD34 cells, since they are easily to quantify, and the so-called mesenchymal stem cells, they have to be seen with an indirect method, and that's rather difficult, and also the protein morphology is not the aim of the study. So we were harvesting from different locations, from different bones in different techniques with different needles and syringes and centrifuges, and we were processing those bone marrow aspirate, and we were looking for the epidemiology, gender, age, diagnosis. And we also had some clinical scores to assess the long-term effect, and we did a lot of statistic analysis. So this is the first study to give you the normal values of those mononuclear cells in the bone marrow. We are in stem cell since 10 years. We've had 3 top publications this year and 2 other publications. We developed several harvesting methods, and you can read this all in Medline. And now I want to point out to next year, because in Istanbul we will be doing a laboratory session where you can try several harvesting methods, and you see that depending on the syringe and the technology you use, you will gain a different cell yield, which is quite important and not published up to now. So what we know until now is that there is nearly 500,000 of publications in the last 70 years about stem cells, even 4,000 publications about arthritis and stem cells, which is important for me as an orthopedic surgeon. It's practical, it's cost effective. Those cells reside in the trabecular surface of the bone, and this is where we want to get them from. And a very important study from Murray 2018 is that in a review of 1,500 studies, he found out that only 42% of the variables that are needed to conduct the study on his own thereafter to understand what they've done are given in the respective papers. So 60% of the information is missing, and this is more or less in nearly all the studies that he's seen. So what we do not know until now is the number and the viability of the leukocytes, the CD34 cells, and even the mesenchymal stem cells, but they are difficult to measure because they have to be cultivated and with indirect means. So we want to assess the influence of age, gender, and also the medical devices and techniques. So this is our patient summary, our epidemiology. They are 21 years with a big range from 2 to 75 years. So female, male, there's an overhang of male patients. And you see we have a lot of different diagnoses of non-malignant diseases. Of course, there's a little bit of bias because the children with autism and cerebral palsy are a bit younger than those with spinal cord injury or with ALS. But however, this is the biggest study worldwide with this number of data. So this is what we get out. There's no difference. These are the green lines between. There's a big difference between children and adults. So children have much more cells than adults. This is only in the first 1 or 2 decades. And the yellow line is that there's no difference between male and female patients. Talking about the number of leukocytes and CD34 cells, you see that they are left skewed, the CD34 cells a little bit more than the leukocytes. So it's not quite a normal distribution. You have to bear that in mind when you do your statistics. You wouldn't think that's like that from the beginning without measuring it. Then when you compare on a patient side, the leukocytes in the CD34 cells, you see that there is a moderate correlation. So the leukocytes of the bone marrow, which are quite easily detected, might serve as a predictor for the CD34 cells, and maybe this is of use in the future when you want to assess which patient is suitable for undergoing a stem cell operation. Maybe you take the one with the higher stem cells. So this is the second finding. So next is when you have an axis with age and the number of 34 cells, you see there is a very strong correlation over the age, even in the first 1 or 2 decades, and then it goes down, and from the year 20 on it's stable. The number of stem cells stays stable thereafter as adults, and this is especially important when you count per microliter and per kilogram, so when you adjust the weight of the patient. So roughly you get 1% of the leukocytes in the bone marrow as CD34 cells, and you see in the younger patients it's 1.4%, and the adults it's 0.6% of all the leukocytes in the bone marrow. But you have to bear in mind that the age of the diagnosis is different. So we have patients with younger patients with other diagnoses than older patients. This is our third finding, this correlation over age. And here you see the details. The correlation is minus 0.8 if you calculate it per microliter per kilogram. If you only calculate it per microliter, it's minus 0.6. That's also nice, also strong, also significant, but it should be adjusted for weight. So third finding. Then these are our data. The bone marrow aspirate is more or less 15,000 leukocytes per microliter, or 416 per microliter per kilogram body weight, which is a more exact measure. The CD34 cells are also here in line 3 and 4, and lower down you see the post-centrifuge concentrate, but this differs depending on the centrifuge you use. We did it with a 1 millimeter needle with a suction over the tip, and we used the first syringe, the first 10 milliliters to calculate those. If you take all the 60 milliliters, then you get a dilution with peripheral blood, and then your values are lower. Again, our values according to diagnosis, also quite interesting. Next finding, that the diagnosis influences the number of cells. So if you look, for instance, autism, line 3, and cerebral palsy have more cells than ALS or spinal cord injury in the first 2 lines. And this is a very significant finding. So you have to bear that in mind. Depending on your diagnosis, depending on your patients you do, your values will be different from mine. So the take-home messages that I want to give you are, first of all, the cells are left skewed. Second, the leukocytes in the CD34 cells correlate moderately. Third, the CD34 cells and age, they correlate very strong. And fourth, the diagnosis influences the number of cells. So this is what you can take home. But you have a confounder. This is how you do it, which needle you use, which syringe, with technique. This is too big to be discussed today. I will give you a lecture on that next year, and you can try it out in the lab, and I will give you my data on that. And therefore, I invite you to come to Istanbul next year to hear this again in more detail. Thanks for listening.